this whole issue about young people. There's been a huge surge in young females identifying as transgender and then embarking on lifelong and taxpayer-funded testosterone treatment. This comes just 8 years after it was ruled that females who identify as the opposite sex or non-binary can get a public subsidy to masculinise their bodies with synthetic testosterone. Here is Liberal Senator Claire Chandler on the matter.
Thousands of young Australian women and girls under 18 are being prescribed a drug which has permanent and irreversible impacts on their bodies, while our medical authorities turn a blind eye to the manipulating of the PBS to have taxpayers pay for it, even as other countries have woken up to the dangers because of the extremely low evidence-based and the devastating side effects detransitioners are now living with.
Right, that was a speech made in the Parliament this week. Not a lot of coverage. It should have a lot more coverage. So to rectify that, I'm joined now by the journalist who broke the issue, Gender Clinic News, Bernard Lane. Bernard, thank you for your time. Take us through these taxpayer-funded procedures. What do they entail? How old are some of the people undergoing them?
Thanks, Peter. Well, this data shows about 1,500 girls and young women last year started on taxpayer-subsidised testosterone, supposedly to treat the male condition of androgen deficiency, which is generally caused by a testicular disorder. The age groups range from about 9 to 13 is the lowest age group, up until about 33. So that's the focus that the data is on, is that group of both minors and young women.
So one of the things people might not understand at home, and I certainly didn't appreciate it till I underwent many years of IVF, is whereas men replenish and basically manufacture sperm all the way through their life, women only have the eggs we are born with, which is why the clock ticks for women. What's the ramifications for young girls going down the path of testosterone? Because if they erode or diminish their egg supply in any way, if they change their mind, what's the chances of getting pregnant and detransitioning? Because that's a big point that Claire Chandler talks about.
Yes, that's right, Peter. So these, let's focus on the young girls. They identify as male, and so they may not want to look after their reproductive system. But when they're given high doses of synthetic testosterone, you know, this is a drug introduced into the body, it's not present in those natural levels in females, then the effects on the reproductive system can be severe. And it seems, I mean, there's a lack of research, but it seems that there's quite a reasonable risk of sterilisation as a result of testosterone. Also, detransitioners in the United States are saying that after a few years on testosterone, they were suffering from vaginal atrophy, in some cases so bad that they had to have a hysterectomy at quite a young age, which has all sorts of its own health effects.
Goodness me. And what about this push? Give us an update for other more surgical procedures. Some they want on the on Medicare taxpayer-funded payments. I mean, this is a chest surgery, genital reconfiguration. I note that the Parliament, when asked to hold an inquiry to look at the yes and the no case of going down this path with young people, the Parliament did not improve an inquiry, which says to me they're not even prepared to hear a counter view. What's the latest, Bernard?
Yes, well, that application by the Plastic Surgeons Society is seeking full public subsidy for a whole range of transgender surgeries. The most common appear to be mastectomies for biological females, but also creation of an artificial vagina in males, including a procedure where, because the male doesn't have much sensitive penile tissue left after puberty blockers, they use a section of the colon to create an artificial vagina, which is very risky. And in the original Dutch research using these treatments, one of the patients died as a result of complications from that procedure. And so the Plastic Surgeons Society here in Australia, they want to do that procedure and a whole range of other transgender surgeries with full public subsidy.
And this is where we've got to have these inquiries. We've got to have all the cards on the table. We've certainly seen it overseas, but for some reason that fails me, it's being blocked by Labor and the Greens in the Parliament in Australia. Bernard Lane, thank you. Keep up your important work.